Have you ever experienced a moment where you expected ejaculation, but nothing came out? It can be confusing, even scary. Many men immediately start thinking something is seriously wrong with their body. Some worry about fertility, others feel embarrassed and avoid talking about it. But here's the truth. This situation is more common than most men realize. And in many cases, it's temporary and treatable. If sperm or semen is not coming out during orgasm, it doesn't always mean infertility or a serious disease. Sometimes it's related to stress, medications, hormonal changes, or a condition called retrograde ejaculation. In today's video, we're going to talk openly and honestly about what it means when sperm doesn't come out, why it happens, and most importantly, what you can do about it. If this has ever happened to you, stay with me until the end because the solutions might be simpler than you think. First, it's important to understand that ejaculation and orgasm are not always the same thing. A man can reach orgasm without releasing semen. This condition is often called dry orgasm. It may happen occasionally or repeatedly depending on the cause. One of the most common reasons is retrograde ejaculation. In this condition, semen goes backward into the bladder instead of coming out through the penis. It sounds strange, but it's not usually dangerous. It often happens because the bladder neck muscle doesn't close properly during ejaculation. Certain medications can also cause this issue. Drugs used for high blood pressure, prostate problems, or antidepressants sometimes affect the nerves that control ejaculation. If you recently started a new medication and noticed this problem, it might be related. Another possible cause is stress and anxiety. The brain plays a huge role in sexual response. When a man is under pressure, worried, or mentally distracted, the body may not respond normally during intimacy. Sometimes the body simply blocks ejaculation. Hormonal imbalance is another factor. Testosterone is the key hormone that regulates male sexual function. If testosterone levels drop too low, ejaculation problems can occur along with low libido, fatigue, or weak erections. Age can also play a role. As men get older, the muscles and nerves involved in ejaculation may become weaker. This doesn't mean a man cannot have a healthy sex life, but the body may respond differently than it did in younger years. Another cause is frequent masturbation or excessive sexual stimulation. When the body becomes used to a certain pattern of stimulation, sometimes ejaculation becomes delayed or difficult during normal intimacy. This doesn't mean permanent damage, but it may require resetting sexual habits. Certain medical conditions can also interfere with ejaculation. Diabetes, nerve damage, prostate surgery, or spinal cord injuries can affect the nerves that control semen release. In such cases, a medical evaluation is important. And now let's talk about what you can actually do if sperm is not coming out. The first step is not to panic. Occasional dry orgasm can happen to any man and may resolve on its own. Stressing about it often makes the situation worse because anxiety interferes with sexual response. The second step is to review your medications. If you are taking prescription drugs and notice this change afterward, consult your doctor. Sometimes adjusting the dosage or switching medication can solve the problem. The third step is reduce stress and mental pressure. Relaxation, exercise, and proper sleep can improve hormonal balance and nerve function. Sexual health is closely connected to mental health. Another important step is stay hydrated and maintain a healthy lifestyle. Good blood circulation is essential for normal sexual function. Regular exercise, balanced nutrition, and avoiding excessive alcohol or smoking can help restore normal ejaculation. If the problem continues for several weeks or months, it's wise to consult a urologist or sexual health specialist. Doctors can perform simple tests to check hormone levels, nerve function, and possible retrograde ejaculation. In many cases, treatment is straightforward. Sometimes doctors prescribe medications that help strengthen the bladder neck muscle. allowing semen to flow normally during ejaculation. In other cases, hormonal treatment may be recommended if testosterone is low. If fertility is a concern, medical professionals can also retrieve sperm directly from urine or reproductive tissues for assisted reproduction. So even if ejaculation is affected, it doesn't always mean a man cannot have children. The most important thing to remember is that this issue is medical, not personal. It doesn't mean you are less masculine, less healthy, or less capable. Many men experience it at some point in life, and most cases can be treated. Communication is also important. If you're in a relationship, talking openly with your partner can reduce anxiety and stress.